The state of Hawaii has received nearly $500 million. They're abusing your children to get money from the federal government.
Wow. Shame on them.
We have someone who has currently been fired from the DOH, exposing the truth, and her words have power, and the truth is power. So I want her to come up here today to expose that.
Aloha, everyone. I'm really glad to see you here, and I'm also sad at the same time that every single parent and grandparent is not standing here too. My name is Dr. Jennifer Smith. I have a PhD in microbiology and molecular cell sciences with a subject matter expertise in virology. I formerly worked for the Hawaii Department of Health, and also during my career I managed a biosafety level 3 lab where we worked with lethal respiratory viruses. In the containment lab, we wore N95 respirators to work with those viruses.
Perfect.
Before the pandemic, I had an article on my desk comparing N95 respirators with surgical masks and spread of influenza among healthcare workers. The study found there was no difference. No difference, meaning the same number of people in both groups got influenza virus. So that tells you how masks work with respiratory viruses. But this is not about masks. This is all about the money. This is a mass kidnapping of our children. This is what abusers do to their victims. They cover their mouths, tell them not to talk. They hold a gun to their head. Think about temperature, all the temperature taking. They isolate them, tell them not to talk to other people. This is abuse, and they're holding our children hostage, and the ransom is ESSER funds. ESSER funds for the emergency relief funds given out by the federal government. And
Money talks.
part of the requirement for the state to get this money is that they comply with certain criteria to get the money. One is universal masking of children. The state of Hawaii has received nearly $500 million. $500 million. It's over $639 million of ESSER funds. This is why they're masking the children. It's not about health. It's not about caring about the children. They're abusing your children to get money from the federal government.
Shame on them.
The leadership of the state of Hawaii cares more about the money than they do about your children. So let's talk about COVID and children. So I prepared this handout. Sorry, another one. So I prepared this handout, and it's all vetted. You can check for yourself, do the math. This is by the numbers for children aged 0 to 17 years of age. Okay? Based on the 2020 census. And I updated the numbers as of April 17th. About 16.5% of all children in the U.S. have tested positive for COVID. So we know that testing positive is meaningless in the absence of symptoms. We know it doesn't mean that people are infectious or contagious. We know that there's a high false positive rate with these tests. As of April 13th, the CDC has reported 980 deaths among children 0 to 17. This is a 0.007% case fatality rate for children. This disease does not affect children. It does not cause severe disease. They are not at risk from this virus. At the same time, I just want to say that I'm not trying to downplay any death. The death of any single child is serious. And any loss experience is very serious. In a study among 121 pediatric deaths, 91% or 75% had underlying medical conditions. This means that those children most likely did not die of COVID. Again, this disease is not affecting children. It is not severe. They are not at risk.
Exactly. Amen.
This is suicide, which is 0.5%, and drowning, 1.5%. of deaths among children are a bigger threat than this virus.
Yeah.
So let's talk about COVID in Hawaii. Let's talk about Hawaii numbers, okay? As of the 2020 census, according to the number of tests reported at the Department of Health, 23,650 children have tested positive, which is a 7.9% positivity rate. 7.9%. Of that, they list 203 were hospitalized. That's less than 1% of all the children who tested positive. Less than 1% required hospitalization. And most likely, it was due to underlying medical conditions. How many children in Hawaii, age 0 to 17, have died of COVID?
0.
Exactly, not a single child. 0%. This does not affect children. They are not at risk from this disease. They do not need to be wearing these masks on their face. This is not about public health. This is about money. And the question we need to ask the leadership is, when will you start putting the children of Hawaii first?
Right.
Yes.
Amen.
Amen.
Hawaii keiki's first. Did you hear that? Hope you guys got that.
First.
Yes.
Got that